And a good evening to you. Welcome to RFL. I'm Richard French. Tonight, we are going to make you a big part of our program. We did this last week. We got terrific reaction. We'll be joined by an emergency room doctor who is ready to tell us both the ground truth and also to answer your questions about coronavirus. Phone lines, opening them right now. Join us. I suggest you do it early at 888-766-2428. It spells out 888-RNN-CHAT. As I said, the phone lines are open. But before we do that, let's get you caught up on the very latest related headlines to COVID. For that, we turn to senior political correspondent Andrew Whitman.
And Rich, as you mentioned, there are congressional leaders in the White House coming to terms on a new relief bill. And within hours of the deal, the Senate had passed it in a pro forma session. The House could pass it as early as Thursday, and the White House says the president will sign it. The bill checks in at close to $500 billion, pushing the total relief response close to $3 trillion. $300 billion from this deal headed to the Paycheck Protection Program, and part of that is earmarked for unbanked rural and minority areas. There's also money for hospitals, agricultural businesses, and the Small Business Administration. States will have access to $150 billion from an earlier relief bill, and $25 billion will go to a national testing program. That was a must-have the Democrats say they held out for.
We do believe the states need money. We do believe, as the president and the governors do, that it's a partnership. But we need a national strategy, as the governors have said, to get the kinds of testing that's done, to get the contact tracing, to make the tests free. You need a significant federal involvement. You need a national strategy. And the president and Mnuchin and Meadows agreed to that.
And lawmakers are already working on the next relief bill, which is expected to fund all of the programs and agencies that you see listed on your screen. Meanwhile, questions, confusion, and anger after a surprise late-night policy announcement from President Trump. The president tweeting out around 10 last night that he was suspending immigration into the U.S. using both jobs and the virus as his rationale. No plan, no details, no time frame, just a tweet. It was not well received. Immigrant rights groups are up in arms and likely headed to court, and lawmakers from both parties calling it little more than a distraction.
It's not really a policy, and he hasn't, I don't think, rolled out any kind of a proposal. It's just, I think, a distraction from what's really going on.
Some of the darkest chapters of our American history are written in times like the World War II, when we scapegoat people and try to change the subject. This is a public health emergency. This is not an immigration emergency. So I hope we can stay focused on what this really is.
I think it's another diversion. The agencies don't even know what it is. No one knows what it is. Yesterday or the day before, we were talking about WHO. I think the president ought to stop these diversions.
And late reporting from the Times, Trump now expected to pause new green cards, but will reportedly back away from any other immigration bans. Maybe. We'll see, and we'll update you when we know more on that. The day's other big virus-related headline, two of the most prominent political figures in the virus response meeting at the White House today. After the meeting between New York Governor Andrew Cuomo and President Trump, of which we've not seen any pictures or video, Cuomo said in an interview that he told the president New York no longer needs the Navy medical ship Comfort, and it can be sent to where it's needed more. Cuomo described the meeting as open and honest, as well as personal and effective. He said the two leaders discussed the need for federal coordination on testing and money for states and cities. And he said the president did not push him to try and reopen New York sooner.
He was inquisitive about what we were doing and what we thought and what we needed, but he never editorialized on what he thought was an appropriate timeline.
Rich, back to you.
Andrew, thank you very much. We're going to get more on that. Let's bring in our guest, Senator Cory Booker, a Democrat from New Jersey. He serves in the Judiciary Committee. Senator, thank you so much for the time this evening. And first off, the stimulus bill, what will this do that you're more comfortable with that the first stimulus bill maybe didn't get to the people who needed it most?
Yeah, look, a lot of our New Jersey businesses didn't get to the table to even partake of that small business fund called the PPP and an emergency fund as well, which both of those funds were exhausted. And that first one was exhausted really because a lot of businesses that had the right banking relationships were able to quickly get at the table, leaving out a lot of smaller businesses, nonprofits, faith-based organizations who were really intended to receive money as well. And so this new fund, some very important changes. We had a standoff on the Senate floor, but we were able to win some very important changes, which is there'll be two segmented pools of $60 billion each. One of those pools will be directed towards people that don't have those normal banking relationships, towards community development financial institutions, minority development depositories, and more, to really help to make sure that small businesses in New Jersey have access. And those emergency grant programs that turn around in 3 days for businesses that were exhausted. You can go in and get a $10,000 a grant or loan for your business. That's been re-upped by $60 billion. So this was something very important to me. That's why I refused to vote on the first thing Mitch McConnell put before us, is because we had to find a way in New Jersey to get all those thousands, frankly, of businesses from our south to our north that are too small, often didn't have the right banking relationships, as well as our nonprofits and faith-based institutions.
Is this a case, Senator, of once bitten, twice shy? You were promised, as were other lawmakers, that there would be oversight in this and that the right people would get it. It wouldn't have been relationship incumbent. The Inspector General got fired right after the first one was passed. How can we be sure that friends of the administration, if you will, won't get first pass at some of the relief that was really intended for the people who need it most?
Look, I have to be honest. I have very, very high degree of skepticism. I know that Donald Trump's hotel in Washington, D.C. Just went for approval to the federal government for help. It's almost like Trump is a landlord and Trump is the owner. So how about the person that has the pizza joint in New Jersey? How could they be sure that there aren't going to be people abusing this system, and that the systems of accountability are in place? To have an inspector general fired was just really, frankly, an insult to taxpayers. And so, I was on a Senate call today with some of my Democratic colleagues. We were reaching out to Republicans on things like the Small Business Committee and others to make sure that they were willing to have oversight hearings to bring some of these businesses down in front of Congress if they're taking advantage of this program. Because all this last few weeks, I've heard from great business after great business up and down our state, frustrated that the intentions of Congress that we fought for, frankly, went to the mat for in some of the cases, wasn't really getting to the people that most needed it.
I know you've been working very closely with Governor Murphy, and we know that Trenton had financial problems before the pandemic. Can you put a face for the public that, not just in New Jersey, but states across this country, if the federal government doesn't come through with state aid, hospitals, schools, law enforcement, fire department, they're going to have to take an axe, Senator, to their state budgets here. And unlike Washington, they can't just pass the buck for the next year. They got to make the budgets right.
I'm so grateful that you bring this up, because for Senator Menendez and I, this is our top priority, because our state governments, county governments, small town governments are all in financial crisis right now. I was talking to Chuck Schumer today, and the final strength of the negotiation, it was requested that the president say publicly that he would, in the next package, do some aid for state and localities. And the president proved that in one of his tweets. He made that commitment. And we now have to hold them to it, because New Jersey is going through a health war right now, but it's also an economic one. And we in our state, all of us should have a chip on our shoulder that we send more tax dollars down to D.C. and get the least amount back of any state. Now, Bob Menendez and I and a lot of our other congressional delegation have been scoring big wins for New Jersey in the last 5 years, and especially in this COVID package, the first one, getting about 80% of New Jersey residents access to direct cash payments, increased unemployment insurance, aid for New Jersey Transit. But we need, in this next bill, with an incredible urgency, to get funding for our state and local governments here in the state of New Jersey.
We saw that tragic scene playing out in Andover at the nursing home. It's certainly not limited to just that nursing home or just New Jersey. But it seems, for all the good efforts that these governors have been doing on the front lines, if there is one blind spot, it's been the nursing homes. How concerned are you that we haven't had the oversight or even the transparency of the nursing homes to make sure that what is a terrible situation doesn't even get worse?
So this is the crisis. And what happened in Andover is inexcusable, because the lack of even just informing people, authorities, family members of the deaths, that's just an assault on human dignity and respect of the common humanity we all share. So let's just put that one aside. That is outrageous, unacceptable. But overall, just like a lot of areas of New Jersey, including our hospitals, our nursing homes right now are strapped for resources, and they are strapped for everything from PPE to the staff that they need, as many of their staff are calling out. Now, we have a serious problem to make sure we have transparency into their operations and a high level of accountability. The governor has really ratcheted up that accountability. These are becoming hot zones all around the country, and we've got to make sure that they have the resources and are being held to the highest of standards for all of us to have parents that live in senior facilities or in senior communities. And so I have a lot of concern. It's something that I was pushing for in this last supplemental that's being approved right now, and we'll be pushing in the next coronavirus package, is the resources we need to do those two things. Make sure those senior facilities have the resources they need, and give the states more personnel and more resources to have fierce, high levels of accountability so we don't see tragedies proliferate in our state.
Am I taking the bait if I go down the line here, Senator, that the president wants to ban all immigration right now? Is that just a distraction to take away from all the issues with testing, et cetera? Or is he just taking this as an opportunity because of the focus on COVID to do something he's been trying to do for 3+ years?
Yeah, I've been having calls on this today because this is a president who governs by what seems to be impulsive tweet with no policy behind it, where you have to take days, sometimes figure out what's going on. We've seen this in international relations where he'll tweet one thing, his generals will say another. But this is the reality. Look around the state of New Jersey. So many of our hospital workers, critical care professionals are first-generation immigrants. And a lot of the talent that we need, we are a state, God, New Jersey, Italian immigrants, Irish immigrants. You want to talk about immigration, making a state strong? New Jersey, we are immigrant proud. And to have him want to seize up legal immigration, folks that a lot of our companies need. I've talked to some of the best businesses here in New Jersey, starting by first-generation immigrants or employing people that are first-generation immigrants. We need to have sound policy that aligns with what's in the best interest of this country. And this is not a left-right issue at all. This is a right-wrong issue. And the president needs to attune his focus to the larger real issues. And I'm telling you right now, the testing we need to have in the state of New Jersey, and to get out of this ridiculousness we saw with ventilators, where governors are competing against each other for everything from swabs to ventilators. We need a federal government that is focusing in on those critical areas where their role can mean the difference between life or death. And so the president's tweets at night, whether he's talking about liberate states and trying to activate people who really think we should take down social distancing right now, and tweeting out things without a backup, he should listen to health professionals and begin to give the kind of support we need in New Jersey so that we can deal with this health crisis and, in a phased, appropriate way, get back to the business of Jersey and America.
Senator, to that point, the president, as you said, he's pushed for open revolt, even against his own White House policies in places like Michigan and Pennsylvania and other places. We showed pictures about people walking out with AR-15s in the middle of the street. Are you concerned that this is sending mixed messages, or are you more concerned that this could get dangerous? You have now the Attorney General who says that he's considering legal actions against governors about not giving more liberties to their residents, even though it's clearly within their constitutional rights for the discretion in their states. Is this politics going on at the White House or something worse?
Look, with Donald Trump, I just don't know how to ever interpret what the purpose is, or what. I don't want to try to get into his mental state. This is what I know. First of all, let's just have a larger circle of compassion for everybody. When I see people congregating for any reason in the midst of a pandemic, I worry about their health and safety. And those folks who were at rallies like that with no masks against each other, we've seen what's happened. We've seen what's happened to ministers who did not abide by state mandates in other states and themselves get sick. People in their congregations die. We've seen some preliminary information about people that went out voting. I was listening to one of the senators from Wisconsin today about they're starting to see that perhaps even people that went out to go vote were vulnerable and got sick as a result of that. So we have to care for each other. Now, what Donald Trump's intentions are when his own federal government is putting forth guidelines that call for lockdowns or social distancing, and then he is on Twitter inciting people to do the opposite. That's just not the kind of leadership we need. And we in Jersey, we don't. When a crisis hits, we don't care what party you are. From Giuliani, who rose to the challenge at 9/11, his approvals were in the dumps, but he rose to the challenge. Chris Christie rose to the challenge of Hurricane Sandy. I don't care what party you are. We need leaders who are going to rise up during crises, offer moral leadership, discipline, clarity, candor, and do the kind of actions that keep people safe and help communities be strong. With Donald Trump, I just scratch my head sometimes because I just see him failing to give the kind of leadership that we need right now, contradicting his own health professionals. It was almost exactly 7 weeks ago that he said that this thing was going to be a big nothing and amount to no cases here. So again, I have frustrations, but I swore an oath to this state, to everybody in this state. I don't care what party you are or what have you. And that's what I'm going to do no matter what the president says. But dear God, he should be more with us. And I'm talking about having Republican governors coming out against what he's saying often. So we've got to unite in New Jersey. We've got to come together as a state. We have proved in the past our grit, our guts, and our goodness to each other. That's what we need together. This is going to be a long, tough haul, but I believe, I have an unconquerable faith that here in Jersey, we're Jersey strong and we shall overcome this.
Well, Senator, I always appreciate the time, and please hold them to their word on that state aid. You know better than I just how desperately it's needed. Thank you again.
Thank you.
Now, when we come back, we'll be joined on set by an ER doctor from New York City. He will join us to not only tell us what's going on in the hospitals, answer questions about everything from testing to how you should protect yourselves as well, and so much more. The toll-free line's open as I speak, 888-766-2428. If you haven't joined us, please do so now.